We often shy away from topics we think we shouldn't discuss as we get older, right? But what if some of those very things hold surprising keys to our well-being? Today, we're kind of venturing into some rarely discussed territory. Advice for seniors. We've looked at YouTube video transcripts, an article, all circling around this powerful idea of self-connection.
Yeah, it's fascinating how they all point in a similar direction.
Our mission here is to uncover some crucial and maybe unexpected info about staying healthy and vibrant in later years. I have to say, the more I looked into this, the more I realized, wow, this is an important conversation.
Absolutely. And what's really striking is how these different sources converge on this idea that, maintaining a connection with your own body can have these really profound, maybe surprising benefits, both physically and emotionally as you age.
Yeah.
We're going to be looking at some information that could genuinely shift how you think about well-being later in life.
Okay, so let's jump right in. What our sources seem to highlight is this often ignored truth. Many seniors, for a whole lot of reasons, could be physical health changes, societal awkwardness, maybe just feeling like it's, not relevant anymore. They tend to stop engaging in self-pleasure. But here's the key thing. Regular self-connection isn't just about desire. It's almost like gentle exercise for your pelvic area. Crucial for keeping blood flow healthy as we age. And it also plays a big role in hormone balance, sleep quality, even supporting prostate health for men. Not to mention things like confidence, a sense of dignity. It feels a bit taboo, maybe, but the potential benefits seem pretty significant.
Precisely. And if you think about it in the broader context of staying healthy with age, it becomes clear this isn't just about sexual function in like a narrow sense.
Yeah.
The actual physical act of self-stimulation, it seems to set off this chain reaction of positive responses all through the body.
Okay, let's start with the physical side then. A major point the sources bring up is what happens to blood flow when self-stimulation stops.
Right? They explain that without that regular engagement, circulation to the pelvic area starts to decrease. Now, you might wonder, okay, why does that matter? But this is where it gets really interesting.
Yeah, it does.
For men, this reduced circulation can apparently contribute to prostate issues and even something called tissue atrophy.
Atrophy, yeah.
Think of it like, unused rubber bands losing their stretch. The tissues down there can lose elasticity without regular stimulation?
That's a good analogy. And for women, it can lead to things like vaginal dryness, irritation, pain, making just everyday comfort, let alone intimacy, much harder.
So it's like the body needs reminding it's still vital, including sensitivity.
Exactly, like a muscle. It can weaken if it's not used. The sources really stress that these changes are often just chalked up to inevitable aging.
Just part of getting old.
Yeah, but maybe not entirely. Regular, gentle self-stimulation or masturbation could be a really powerful way to prevent or at least delay these issues. It's not just about pleasure seeking.
It's vital for looking after your pelvic health, keeping tissues resilient, supporting long-term comfort and responsiveness.
And for men specifically, the info around prostate health is really compelling. Our sources detail how the prostate, that small gland important for both sexual and urinary stuff, can be negatively affected when masturbation stops.
Right.
Apparently, without regular ejaculation, the fluids the prostate makes can start to build up. That leads to something called prostate congestion.
Ingestion, yeah. And that buildup, unfortunately, can increase the risk of a condition many older men know well, benign prostatic hyperplasia, or BPH.
Ah, BPH. Leading to those frequent, frustrating bathroom trips, especially at night.
Exactly. And the congestion itself can cause discomfort too, like a dull pelvic ache, pressure, sometimes even inflammation or infection.
Wow.
What's fascinating, though, is the emphasis on ejaculation as a natural support for prostate health. The sources explain that regular ejaculation, partnered or solo, helps clear out those fluids, stimulates blood flow, keeps the gland working well.
So it's like flushing the system.
Kind of, yeah. And this isn't just guesswork. They mention medical experience, even research suggesting a possible link between regular ejaculation and maybe a lower risk of prostate cancer.
Really?
Yeah, presented as a potential natural preventative measure, which is quite significant,
It really is. And the sources go even deeper into the potential decline in penile function if sexual activity, including masturbation, stops after, say, age 60. It's explained that this lack of activity reduces blood flow, means less oxygen getting to the tissues, and can even lead to tissue stiffening. They call it fibrosis. nerve damage can be involved too.
The analogy they use is like unused leg muscles getting weak. It really makes sense.
Yeah, it does.
One source even mentioned a 2023 study linking reduced sexual activity to a significantly higher risk, like 20% higher of erectile dysfunction, specifically because of poor circulation.
20%, wow. That really underscores how crucial consistent blood flow is for keeping things healthy and functional down there.
Absolutely. And they describe this decline as often gradual. Maybe morning erections disappear first. Okay. Then less response to touch or fantasy. Eventually, even medications might not work as well because the underlying blood vessel health isn't great.
So the key message isn't just about performance.
No, not at all. It's fundamentally about preserving circulation and, for many, a part of their masculine well-being. The suggestion is pretty simple. Occasional solo activity, maybe once or twice a week, as a proactive step.
Just to keep things ticking over.
Essentially, yes, to support that circulation.
Okay, circling back quickly to prostate congestion, the sources paint a clear picture of the symptoms, that nagging, dull ache in the pelvis, pressure, especially after sitting, needing to urinate frequently. It's explained that when ejaculation isn't happening, the seminal fluid can stagnate, thicken.
Which leads to inflammation.
Right, and potentially a painful condition called chronic prostatitis. There was also that interesting mention of a Harvard study suggesting regular ejaculation might lower prostate cancer risk.
Yeah, that connection keeps coming up.
One source even shared a story, quite eye-opening, about a patient facing a swollen prostate, a biopsy scare, after 2 years with no sexual activity at all.
Wow. That really brings it home.
Yeah, it does. The clear message seems to be occasional ejaculation offers real benefits for keeping the prostate healthier.
Exactly. It just reinforces this idea that our bodies have these natural processes that thrive on regular activity. And sexual activity, including solo, plays an important role here, especially for the prostate.
Okay, now shifting gears a bit, the sources also explore the emotional and mental side of stopping self-connection. This is often underestimated, isn't it?
Hugely. It's not just physical. There can be significant emotional fallout.
The idea that seniors might start feeling disconnected from themselves, almost like, as you said before, just maintaining an aging machine, that's profound.
It really is. And the sources talk about subtle shifts, maybe less interest in appearance, self-worth kind of dipping.
Feeling invisible.
Yeah, that feeling of invisibility. What's insightful here is reframing masturbation, not just physically, but as a way to affirm your sense of self.
How so?
Like it's a way of saying to yourself, I am still here. I still feel, I still matter to myself. This private act can reignite a sense of agency, reinforce that your emotions, your experiences still count.
Right.
Without that connection, there's a risk of loneliness feeling deeper, anxiety worsening, that kind of inner spark fading. And this emotional disconnection can even affect relationships with others.
That makes total sense. If you feel detached from yourself, connecting with others must be harder.
Absolutely.
And the sources also bring up brain chemistry, hormones. They explain that sexual stimulation releases this great mix of natural chemicals, dopamine for motivation and pleasure,
Oxytocin, the bonding hormone.
endorphins, natural pain relief, and mood boost. Prolactin for relaxation.
Yeah.
It's like your body's own anti-aging cocktail for mood and sleep.
Yeah, and self-connection helps keep that flowing. The sources point out that if that regular release declines, which can happen when self-intimacy stops, it might contribute to more anxiety, mood swings, sleep problems, maybe even a weaker immune system as we age.
So the encouraging message is
That regular, gentle self-intimacy is a natural, effective way to support emotional balance, good sleep, clear thinking, overall happiness. It's giving your brain and body the support they need.
and then there's just the basic human need for touch.
So important.
The sources remind us, as we get older, opportunities for physical touch often decrease. And that can include self-touch. But touch is fundamental, right, for emotional and physical health.
Absolutely. And stopping self-touch can contribute to feeling disconnected, numb, isolated, even within your own skin.
So here, masturbation is framed as what? Self-care.
Exactly. Self-care, self-affirmation. A way to remind your body it's still valued, still your home. It helps keep you emotionally grounded, physically present.
Without it, there's that risk of slipping into emotional numbness, treating your body like an object.
That's the concern raised, yeah. This potential for feeling hollow, invisible. It's not just about sex, it's about vitality, feeling alive.
Yeah.
And again, those neurochemicals, dopamine, oxytocin, endorphins, they're key for mood, anxiety reduction.
Didn't one source mention a study?
Yes, linking lack of sexual activity in older men to a higher rate of depression. The underlying message seems to be Regular self-pleasure can be vital for keeping the brain engaged, the spirit alive.
It really paints a picture of declining emotional connection, intimacy with oneself, that fading spark you mentioned.
Growing distance from your own being, which can lead to feeling invisible, unwanted, like you don't serve a purpose anymore. And again, it links back to those hormones released during self-pleasure supporting mood, reducing stress, maybe even protecting brain health.
And without that release,
Potential for more loneliness, irritability, maybe even cognitive decline. That's the connection the sources suggest.
now, a really important piece here is tackling the shame and stigma.
Oh, absolutely crucial.
Society, culture, religion, they've all sent messages historically that stigmatize self-pleasure, especially for older people. The sources really encourage listeners to question those old beliefs.
Yeah, to reframe masturbation as normal, natural, even potentially healing, not some moral failing or weakness,
And letting go of that shame.
can be incredibly freeing. It allows you to care for yourself fully, joyfully, which can boost self-confidence, lead to more inner peace. There's a strong link highlighted between self-acceptance and self-respect.
Okay, so for listeners who might be thinking about reconnecting with themselves this way, what's the practical advice?
The sources emphasize approaching it gently, comfortably, respecting how your body might have changed.
Right.
Creating a private, relaxed space is key. No pressure, no rushing.
And lubrication.
Highly recommended. Good quality lubricant for comfort, enhanced sensation, especially if dryness is an issue. The main thing is being gentle, tuning into how your body feels right now.
Right.
Exploring without specific goals.
Just being present.
Exactly. Listening to your body, being patient. It's about presence and self-care, not performance or perfection. And the reassurance is that even a little regular practice can benefit circulation, emotional balance, well-being.
Okay.
So as we kind of wrap up this deep dive, the big message across all the sources seems to be that aging is really about rediscovering your inner strength, your depth. And our bodies at every stage deserve our care and kindness.
And in this context, self-connection later in life isn't just about, lust or physical sensation.
No, it's framed as a powerful affirmation. I am still here. I still matter. I am still whole.
The potential benefits sound pretty profound. Reclaiming dignity, vitality, maybe walking with more lightness, sleeping better, more joy day to day.
That's the potential, yes.
Yeah.
The sources really encourage us. Be kind to yourself. Care for your body. This exploration can be a powerful act of self-acceptance, gentle self-care, valuable at any age.
It definitely makes you think, doesn't it? That maybe true vitality comes from a deeper connection within ourselves than we often realize.
A provocative thought to leave with.
This has certainly been a deep and I think insightful exploration into a sensitive but really important aspect of senior health. We definitely encourage you, the listener, to take some time, reflect on this, consider its relevance for you or maybe people you care about.